Good evening. It's Thursday, March 19th. Thanks for joining us tonight. I'm Maya Trabolsi. Cashing in on the coronavirus, the government's plan to hand out $1,200 per person. The proposal comes as local leaders look to curb more new cases and other pressing concerns. We begin our coverage with KPBS health reporter Taryn Mento live in the newsroom. Taryn.
Maya, we're waiting on the latest numbers from the county on local cases. That's expected tonight. A big development right now is a request from California Governor Gavin Newsom. This afternoon, the governor sent a letter to President Trump formally asking that the USNS Mercy hospital ship be sent to the port of Los Angeles to help ease pressure on the healthcare system. He says this: we project that roughly 56% of our population, 25.5 million people, will be infected with the virus over an 8-week period. Now, more on what's happening locally. Moments ago, San Diego Mayor Kevin Faulconer gave us an update on the city's response and how he's communicating with health officials in Tijuana.
And I urged very strongly, in no uncertain terms, for the state of Baja to implement the very same health directives that we are doing in San Diego County, to close bars and nightclubs, to move restaurants to takeout or delivery only, and to strictly limit the public gatherings. In essence, we want to have one set of guidelines, if we can, for both Tijuana, for San Diego County. It makes all the sense in the world.
The mayor also said two things the public can do right now is to donate blood and help with food distribution. Again, we still don't have the latest numbers on cases in the county. As of last night, that was 80. But officials again today said that was likely a small portion of what is actually out there due to the widespread lack of testing. Taryn Mento, KPBS News.
Thank you, Taryn. And the State Department issued a new alert urging Americans not to travel internationally. And those out of the country are being asked to return home unless they plan to remain overseas. It comes as the number of confirmed coronavirus cases in the U.S. has now topped 11,000. Daryl Forges has more on the increased demand on our healthcare system.
It's a medical war. We have to win this war.
President Donald Trump is pushing the FDA to fast-track approval of treatments for coronavirus, mentioning one anti-malarial drug.
It's been around for a long time, so we know that if things don't go as planned, it's not going to kill anybody.
The FDA says any drug would have to go through a clinical trial to make sure it's safe and effective before it's released. Possibly welcome news for those in the medical industry battling with an ever-increasing number of patients and an ever-dwindling amount of supplies like masks, ventilators, even hospital beds. Vice President Mike Pence says the private sector will step in to help supply hospitals, noting that officials have, quote, identified tens of thousands of ventilators that can be converted to treat patients.
We remain increasingly confident that we will have the ventilators that we need as the coronavirus makes its way across America.
Pence also says masks are available now and millions more are coming, but health officials say they aren't getting them yet. Supplies are so low in some places, the Centers for Disease Control and Prevention are now saying doctors and nurses can use homemade masks as a last resort.
I know on this first day of spring that we'll get through this, and we'll get through this together.
Daryl Forges, KPBS News.
Senate Majority Leader Mitch McConnell is backing a plan to pay Americans to help the country get through the coronavirus pandemic. Congress is working on a $1 trillion economic stimulus package, and it calls for giving each person a direct payment of $1,200 or $2,400 for couples. Aid would be phased down for individuals making $75,000 and for couples making $150,000. The minimum payment would be $600. Now, families would also get $500 for each child. The plan still needs full approval. Starting today, the Veterans Benefits Administration is closing regional offices. KPBS military reporter Steve Walsh says vets can still make claims online, but for some, that's still a problem.
The VA announced Wednesday that it was canceling all in-person appointments and counseling services to limit the spread of the coronavirus. The VA is still open, but all benefits claims hearings are being done remotely. Sam Flores is a veteran service officer for the American Legion. He guides veterans through the claims process.
No one is in the same room, obviously, for space and the peace of mind. So that's what they're gearing towards now. So as long as the veteran has a smartphone, the veteran service officer has a smartphone or a tablet, then they can communicate via that link with the veterans law judge and continue with the hearing.
The problem is some older vets may not be comfortable with the technology.
It's really hard. A lot of the veterans that we represent are up in age, and they don't do the email or the Skype or the Facebook or the e-benefits platform that the VA provides. So now it's our turn to actually reach out to them and, number one, make sure they're okay. Number two, give them a ease of mind as far as we are still taking care of your processing needs.
Flores and others are reaching out to the veterans' families and friends to see if they can help set up some of this equipment. What they can't do right now is go to their homes or ask them to stop in. The American Legion has also canceled its meetings and shut down posts to protect its members. The VA is letting vets cancel their meetings with the judge for now, but Flores says that will mean delays in processing their claims. Steve Walsh, KPBS News.
Local leaders are reassuring immigrants that they have a right to seek help during this crisis. City and county officials and legal experts are telling communities that bilingual resources are available regardless of their immigration status. They also say no one will be asked for documents when seeking care.
You have a right to health care. You have a right to access the food that's available. Your children have a right to education. We have a right to access these services, and we should not be afraid.
Aside from government offices, immigrants are also being urged to use the 211 non-emergency information line. Families can also pick up items from food banks and meals from schools. In a move to encourage more people to seek medical help, ICE will stop most immigration enforcement operations in the U.S. The agency says it will use alternatives to detention and only deport those who have committed crimes or pose a risk to public safety. U.S. Citizenship and Immigration Services are also impacted. The agency is responsible for administering green card and naturalization ceremonies, as well as citizenship, asylum, and refugee processing. All in-person services, including interviews and naturalization ceremonies, will be suspended until at least April 1st. The lines are long, the demand urgent. No, we're not talking about food lines or even testing, but rather gun sales. KPBS reporter Matt Hoffman looks at why all the rush.
We're running out of guns.
A.O. Sword Firearms in El Cajon has been busy lately.
We have about 10 times our normal sales.
Gun store owner David Chong even has lines forming outside of his shop.
I apologize for my voice. I've been directing traffic for 6 days now, and so I just lost my voice.
Chong is seeing lots of first-time gun buyers, most saying that coronavirus hysteria is the reason for their purchase.
90% of our customers, hundreds of guns, are going to the people who have not owned guns before, haven't felt they needed a gun before, and then they say, wow, that's really the only way that I'll be able to personally ensure my safety from other people.
People are getting crazy over this coronavirus, and I want to be able to protect myself and protect my family.
The craziest things going on in the world and about coronavirus and everything is going crazy. I just want to have something like at my house to protect myself if something happened.
This is the kind of shotgun many people are looking for.
Chong says many first-time buyers are looking for shotguns.
This is a pump shotgun, so you pull the trigger once and then you have to rack it.
Handguns are also flying off the shelves.
So this is one of our most popular handguns. It's a CZ-SP01.
Some new customers are unaware that they cannot just walk away with the gun the same day they buy it. In California, there is a mandatory 10-day waiting period, plus people have to pass a background check and safety test. But that's not stopping buyers.
I expect to be completely out of inventory in the next 2 weeks.
Even though they're busy, the store is taking precautions to limit potential exposure to the coronavirus.
The health department's only going to let us have 6 people in at a time.
Ammunition is also in short supply right now. Soon, Chong and other gun store owners may find themselves scrambling for inventory. Matt Hoffman, KPBS News.
San Diego State University has one student who tested positive for COVID-19. He recently returned from study abroad in Italy. The university says it told students returning from countries with significant outbreaks to self-quarantine for 14 days. But KPBS investigative reporter Claire Tregesser found those instructions were not clear, and the student with coronavirus didn't follow them.
SDSU says it asked returning study abroad students to self-quarantine for 14 days and to go to their permanent homes, not SDSU, when they got back to the United States. But the student who tested positive for COVID-19 didn't do that. When he came back from Italy, he visited San Diego, according to SDSU. He went to 2 offices on campus and potentially exposed his off-campus housemates to the disease, as well as others he came in contact with.
And then we were supposed to do a research project abroad, so that was like aside from our studies.
Another SDSU student, Adrian Murdoch, was also studying abroad in Italy, not with the student who tested positive. She had only been in Italy for less than a week when the coronavirus outbreak began ramping up there, so she left. She shared the email she got from SDSU telling her to come back to the U.S. It didn't say to self-quarantine. In fact, it said specifically, no order for quarantine or self-isolation exists for individuals from any area other than mainland China, and to pay attention to your health during travel and for 14 days after you leave. KPBS asked SDSU officials to comment, but a spokesman referred us to the school's website. There it says it can't force students into isolation. There is nothing in place that supersedes the rights and protections afforded to every citizen under the Constitution, it says. Dov Fox, a law professor at University of San Diego, says that's correct.
Schools can set public health rules about when you're allowed to work there or be on campus in dormitories or take classes, but it doesn't have the power of police or otherwise to require quarantines.
Fox says governments should also only force quarantines as a last resort. Claire Tregesser, KPBS News.
Our partner iNewsSource has an update on how the novel coronavirus is hitting Imperial County, where 2 cases have been confirmed. There's no evidence the virus is spreading, but health leaders have warned the number of cases could rise. 180,000 people live in the county, and there are fewer than 300 hospital beds. Respiratory illnesses are prevalent there, with high asthma rates. But Imperial Valley health officials say they are prepared for COVID-19 and are focused on prevention.
Stay home and recover. Don't expose other people in the community. Don't expose medical providers by going to a hospital or a clinic if you don't need to.
For more on what's happening with the virus in Imperial County, you can go to inewssource.org. And iNewsSource is an independently funded nonprofit partner of KPBS. With many San Diegans not traveling to work or school, the public transit system is suffering a big drop in ridership. KPBS Metro reporter Andrew Bowen says there may be cuts to service.
Public transit stops are quiet these days, especially at places like SDSU, where classes and campus operations are on hold and students have been ordered to move out of dorms. Trolley passenger Derek Graham says he was shocked to see the SDSU Transit Center so empty.
This is dead. It's like a zombie down here. Usually around this time of day, it's a lot of traffic. When I came down here to the trolley stop, I wasn't sure if they're running today because I didn't see nobody.
On Thursday morning, the Metropolitan Transit System Board of Directors held its regularly scheduled meeting via conference call. The news from CEO Paul Jablonski was not good.
Ridership is down, and I think we haven't seen the bottom yet. My guess is that overall it's probably approaching 40%. So we are preparing plans to reduce service to meet demand.
The drop in fares means a big hit to the agency's budget. Officials say they may switch most routes over to Saturday schedules, when buses and trolleys come less frequently. With some added service in the mornings, MTS will keep its regular schedules at least through the end of March. Andrew Bowen, KPBS News.
Ridership is also down for the North County Transit District, and now they're making changes. The NCTD is reducing coaster service on weekdays beginning Monday, March 23rd. All weekend service will be suspended beginning Saturday, March 28th. For most up-to-date information, visit gonctd.com/service alerts. Census workers won't be going door to door for now because of the coronavirus. The Census Bureau is asking everyone to complete their 2020 census questionnaire online. Field operations have been suspended nationwide until at least April 1st. More detailed census surveys are now being conducted by phone instead. The effort to count every American kicked off less than a week ago. More than 11 million households have responded so far. We're following all of the latest coronavirus developments for you at kpbs.org. Click on the Tracking COVID-19 link on our homepage and you'll be taken to a page with all of our recent reports. You can find that right now at kpbs.org. Today is the first day of spring, but it sure didn't feel like it. Here's a look at the gray skies, wind and rain in Poway just earlier today. The good news, we may get a break from the wet weather. Justin Povic has our forecast.
Good evening. We continue to follow cooler than normal temperatures along with precipitation roughly around 1/4 of an inch the last 24 hours to San Diego. And it's been a relatively wet go of it as we stack up the last several days. So last week and for the month, roughly right around 150% of the normal. You can see the spin in the atmosphere. Upper level low really starting to go to town well off to the east as we talk about the Rockies, but still some energy left behind. So below average temperatures continuing the remainder of this evening, but we're also tracking still some moisture in place and out east, roughly at around 4,000 feet. Still that potential for, again, a little bit more snow. Again, many of these winter weather advisories going into the mid-evening hours. And like I said, snow amounts here are going to be averaging anywhere from a few to several inches over the higher terrain. Most of this will be expiring roughly right about 9 to 10 o'clock time frame. And here's a look at futurecast as we go throughout the evening. Still that potential for a couple of showers, but again, as we go through time, and especially as we work our way into Friday, the tendency will be for some drier air to begin to march its way into our area. That's a breakdown of the weather here for tonight. And again, we're going to be talking about the conditions again, still featuring a couple of showers around Oceanside, drier weather sliding off toward the east. And notice a tendency for quieter conditions in terms of precipitation on Friday. Low pressure making its move out east. Still cool temperatures, though. We average around 66 this time of the year, so still a degree or two below normal. Definitely cool today, only in the low 60s. Oceanside bouncing back a bit, 64 degrees. Ramona 59 and Mount Laguna topping off at 43. We turn stormy again off to the north as we venture into next week, but we'll still see the chance for at least a couple of showers. Here's a look at your coast forecast. To get a shower returning on Monday out inland. Again, a shower Monday, temperatures into the 60s, mountainous locations into the 40s. And again, over the deserts, we'll talk about numbers into the 70s. For KPBS News, I'm meteorologist Justin Povic.
A local lab is hoping to fight the coronavirus pandemic with its experimental DNA-based vaccine. KPBS health reporter Taryn Mento has been following the progress at Inovio Pharmaceuticals since January and brings us this update.
What's the latest with the vaccine?
Yes, certainly. So we've managed to accelerate the timelines considerably, Taryn. So we're now looking at getting into the clinic next month in April. We don't have an exact date yet, as you can imagine. There's still a lot of organisation, a lot of moving parts at the moment. But when you think that we only started designing this vaccine on the 10th of January, it's pretty remarkable that we're aiming to be in the clinic by by next month. And another goal that we've set ourselves is that by the end of the year, we hope to have 1 million doses ready for distribution, which is really quite a remarkable scale up from kind of a small scale trial like we're doing at the moment.
There's still a lot more testing to go.
Yep.
Why have 1 million doses ready for distribution by the end of the year? What's the point?
I think it's just really good to have a figure to target. We thought that on the scale up basis, targeting 1 million doses, it's still a significant number, a number that could be used to really protect people, healthcare workers, frontline medical professionals that are going to potentially really need this vaccine, and also potentially people who have underlying health issues as well, which is obviously a tier 1 group that needs to be protected.
Is the expectation that you would have completed all 3 trials by that time?
No, absolutely not. So as I mentioned, we'll be starting our phase 1 testing in April. We would hope to get what we call an interim readout, which means, you would start to get to see, you wouldn't get the whole through trial, but you'll get to get some of the data out of that, certainly by late summer, autumn, fall type time. And then we would be hoping to move into phase 2, which is where we can actually ask the question, does the vaccine work to protect people against the virus? And we would hope to do that very, very quickly. But that would have to, of course, have the say-so of the regulatory authorities.
And with the first phase of the trial starting next month, I believe you've already identified those locations, correct?
That's correct, yeah. So we're going to be 2 sites for our phase 1 trial, starting in the US in April. We're looking at 1 site at the University of Pennsylvania and 1 site in Kansas City.
Based on what you know about how this virus works and how viruses like it work, is this what we should be doing, or should we be doing more? Should we be doing less?
To be completely honest, we don't really have a choice. If we don't do what we're doing right now, the situation will get a lot worse a lot more quickly. So I'm very supportive of all the measures that have been put in place, both at the sort of local and national level. It seems like the testing now is starting to come through. We're getting higher numbers of testing, and that's absolutely critical. So that's a positive, definitely, and I'm sure over the days and weeks that's going to improve more and more. In late December, when I first heard about this virus, if anybody had asked me, would we be essentially shutting down all spheres of public interaction in San Diego in a couple of months' time, I think I wouldn't have believed that would have been possible. And yet here we are today, and it's a reality, that my children are at home and, predicting not to be at school for another month. And it's almost hard for me to get my head wrapped around that, and I kind of am living and breathing this every day, so I can't imagine what it's like for everybody else.
Well, thank you so much.
And doctors want to keep patients from overcrowding facilities, so they're pushing for some appointments by phone. But this caused a financial burden for clinics that serve low-income patients who are insured by government-funded Medi-Cal. Providers are reimbursed by Medi-Cal for care that they give, but that doesn't usually extend to telehealth appointments. So state officials are making progress to fix the problem during the national emergency. Nonprofit Family Health Center of San Diego says it had been providing telehealth calls for weeks. CEO Fran Butler-Cohen says that's because it will help alleviate pressure on healthcare systems.
If we don't at least interface with these patients, then what's going to happen is our emergency rooms are going to be completely clogged, more so than they are now.
And Butler-Cohen estimates they are providing 300 telehealth appointments each day. The change will allow them to bill retroactively for many patients, but the state is still working to cover the service for more people. Shopping malls across the country are closing because of the coronavirus outbreak. Simon Property Group is closing its malls through March 29th. That includes 3 shopping centers in San Diego County. So that's Fashion Valley Mall, Carlsbad Premium Outlets, and Las Americas Premium Outlets. The announcement follows the closures of several department stores, including Macy's, JCPenney, and Nordstrom. San Diego County libraries are canceling curbside pickup service, citing concerns about spreading the virus. The county's 33 branch libraries and 2 bookmobiles will be closed. However, you can still digitally access all the library's ebooks and e-magazines. Just download the Libby app for ebooks or Flipster for e-magazines. For now, no returns will be accepted, and the due dates for any checked out materials will be extended until the libraries reopen. And while the county continues to coordinate its response to the pandemic, neighbors in San Diego are reaching out and offering assistance to one another. It's called mutual aid, and it could save lives. KPBS reporter Max Rivlin-Nadler has more.
Through websites like Facebook or Nextdoor, neighbors in San Diego began to reach out to one another this week. They were asking if people needed anything like food or sanitizer, but couldn't make it out to the store, or it wasn't safe for them to do so. One group of neighbors and activists trying to coordinate this type of community response is called We All We Got SD. Christina Griffin-Jones started the mutual aid group this weekend with fellow organizer Candy Custodio-Tan. Griffin-Jones says the goal is to connect people who can help to those who need it, without getting anyone exposed to the virus, and making sure that people stay in touch with each other, even if it's just through a phone or video call.
Because mutual aid is also information, right? Mutual aid is checking on folks via Zoom call, right? Mutual aid is text messages, phone calls. It's not just this physical stuff or this monetary stuff.
The organizers say they're not trying to reinvent the wheel. They want to spread information and make sure that people who need help can find them from either their neighbors or existing resources. They've gotten requests from people needing sanitary wipes, food, meat, non-perishables, and just someone to talk to. Without an active community during this time, the organizers believe the most vulnerable of our neighbors will fall through the cracks.
We are here kind of in our communities. It's like the whole thing that when you say we all we got, it's welcoming because I got you, you got me. And the more we all look out for one another, the bigger that is.
You could find more details at weallwegotsd.com. Max Rivlin-Nadler, KPBS News.
An update now on our top story, the city and county's response to the coronavirus. We just got an update from the county. The number of confirmed cases now is 105, and that's up from 80 just last night. County health officials asked local hospitals and labs to comply with county orders to report all testing results, whether it's positive or negative. A lack of reagent fluids is limiting the number of tests many facilities can complete in a day. That's throwing off the regional estimates of testing capabilities. You can find tonight's stories on our website, kpbs.org/evening edition. I'm Maya Trabulsi. Thank you for joining us tonight.